In this presentation, I will talk about the caries preventive measures, or simply caries prevention. In the caries etiology video, I have mentioned that the caries is a multifactorial disease and has four factors to uh, contribute to it to happen, so that by targeting the etiological factors of the caries, we can prevent it from happening. The first and most important one is the targeting of the bacteria in the bacterial plaque biofilm, and that is by the use of the mechanical, chemical methods, and the regular dental visits. The brush, by when I say the mechanical methods, I mean the correct techniques and frequency of toothbrushing, the correct techniques and frequency of flossing, and the indicated use of the indicated and limited use of the chlorhexidine. Also, the regular dental visits are very important and will, of course, prevent the dental caries from happening. The second thing is by targeting the sugar source or the carbs. Um, this is very important and can be regarded in two ways, which are the frequency and the quantity of the carbs, but the frequency is way much more important than the quantity of carbs intake. The third thing is the strengthening of the tooth structure. And when I say the strengthening of the tooth structure, I mean the conversion of the hydroxyapatite crystals, which are the building blocks of the tooth structure, into a fluoroapatite crystals, which are more resistant to acid dissolution and subsequently caries procedure. And that is actually happened by the fluoride incorporated into the structure. This is can be done by the systemic ways or the topical ways. The systemic ways, which is the systemic water fluoridation, which differs from state to state and from country to country, and by giving the fluoride tabs to the people who are not supplied with fluoridated tooth systems, or by the use of the fluoridated mouth rinses. These are very active and effective methods to prevent dental caries. Also, the professionally applied preventive measures, which are the fluoride gels, the fluoride foams, the fluoride varnishes, and the sealants. All of these preventive measures release fluoride and are very good to prevent the dental caries from happening. Finally, the salivary flow stimulation, for example, by eating fibrous food or chewing gums, uh, and specifically the sugar-free chewing gums. Actually, they are not sugar-free, but they contain a 5 carbon sugars, not 6 carbon sugars like sucrose, but instead they have a 5 carbon sugar, which is, for example, the xylitol. The xylitol is a 5 carbon sugar which cannot be metabolized by the bacteria and will not produce acid, so that there will be no caries. But these chewing gums have sugar, but a 5 carbon sugar. The final thing is the time control. And when I say time control, I mean that we can super saturate the acids produced by the bacteria so that we can delay the caries procedure from happening. And actually, this is a research that I am working on right now to prevent or delay the caries procedure from happening. Thank you for improving yourself. Always try to know, spread knowledge, and construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.